Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our Friday panel on Jasper 1 year after the wildfire. But first, calls for action.
There's this misconception that measles is a routine illness, a routine childhood illness, and it's not.
The measles outbreak in Alberta has now crested the 1,500 cases mark, and with no signs of slowing down, doctors and infectious disease experts are calling the situation critical, and they're urging the province to do more. Joining us now to pick up the discussion, Dr. James Talbot, a public health physician and former chief medical officer of health in Alberta, and Jeff Johnson is a professor and the former dean of the School of Public Health at the University of Alberta, also trained as a pharmacist. Gentlemen, good evening. Welcome to Alberta Primetime.
Thanks for having me.
Thanks, Michael.
Dr. Talbot, we'll start with you. You were among physicians speaking out this week, labeling the outbreak an epidemic, something the province has not done. What are the consequences of a reluctance to treat it as such?
Well, let me just start off on, is it an epidemic or not? I mean, more cases this year than we've had in the last 20 years in total. We've got 10 times as many cases as the provinces to either side of us, and many of the people that they have who are infected have Alberta exposures, at least some of them do. And we also have cases cropping up, and have been for the last 16 weeks, in every single part of the province. And finally, we have more cases in Alberta with a population of 5 million than they do in the United States with a population of 340 million. So there's no logical reason to stop, not to call this an epidemic. The consequences are that the public are then lulled into a sense of complacency, that this is just as business as usual. It's not. We're the second worst jurisdiction in North America behind the state and Mexico. And that the government doesn't move into a level of concern that's appropriate for dealing with it. And the proof of that is not that I say that the government is failing to do what it needs to do in measles. It's that measles tells the government that it's not doing what it needs to do, because we continue to have these cases which are likely to accelerate, unfortunately, once the school year starts.
Professor Johnson, from a public health standpoint, what does this current outbreak dynamic in Alberta reflect to you?
Well, I think it's a reflection of the anti-science and the anti-evidence approach that our current government has taken to public health. We've seen lower rates of vaccinations for the measles outbreak now. Currently, we see really low vaccination rates for COVID vaccinations in the past year. And it seems like our government is actually even discouraging the use of proven effective vaccinations. Vaccines have two purposes, to protect the individual and to protect the rest of the population. And we're seeing these low rates and messages from our governments that actually seem to be discouraging the use of these proven effective and safe therapies.
Dr. Talbot, how does the government's response to the outbreak compare to the measures you feel it should be taking? What should that response look like?
Well, this government, both during COVID and now, has shown a tendency to put the measures that need to be in place late and then take them off when they're working early. And they're following that pattern on this. So the failure to describe it as an epidemic doesn't matter as much as the fact that they're not treating it as if it were an epidemic where anybody who travels in the province is at risk. So for instance, we used to not recommend that 6-month to 11-month-olds get immunized because, one, we had 95% coverage, so they were protected, and two, we didn't have measles circulating in the country. It had been eliminated. But they are at highest risk of serious outcomes. And so what the province reluctantly did was open up the indications for immunization for 6 to 11-month-olds in the north and central and south zones, where it was clear that most of the cases were. But to this date, they still have not opened up those indications for infants in Edmonton and Calgary. And I don't know what they're waiting for, because you need time to make sure that you get them. And by definition, 100% of them are not immunized. So that's one thing that would show that they were taking this seriously. A second thing would be to have regular updates with the public, explaining where the hotspots were, what was being done, what new resources were going to go into place, and describing whether or not we were winning or losing. And that would ordinarily be done by the Chief Medical Officer of Health. But as we saw with the last Chief Medical Officer of Health, once they enter the ministry, that's the last we hear from them. So,
Professor Johnson, on that resources front, you're trained as a pharmacist. What's come of the role of pharmacists as public health professionals, and the role they could or should be playing in the here and now?
Yeah, the pharmacist's role within Alberta is actually one of the leading roles in Canada and even around the world. Pharmacists are really an important public health professional role. And we've seen through the past few years that pharmacists are administering more and more vaccinations, the influenza vaccinations. And last year, the pharmacists in communities, in all communities in Alberta, administered almost 90% of all the COVID vaccinations. And so playing a really important role where access to vaccinations is really important. And one of the policies that the government is introducing for this coming year with COVID vaccinations is taking that access away. They're not having pharmacists administer those vaccinations. As I said, even though they administered almost 90% of the vaccinations last year for COVID, this year it's going to be limited to public health clinics, which are not going to be as accessible as the community pharmacies, particularly in some of the smaller communities. And so that's a concern. And again, an approach that just doesn't make sense from this government's new policy for COVID vaccinations.
Dr. Talbot, it's midsummer, but the start of the school year is only weeks away, as you pointed out earlier. What message then do you send to Albertans, Alberta parents?
The message for Alberta parents is that if you have children at home who are under the age of 5, once school opens up, their siblings will show up. Their playmates who have siblings will be showing up. And if measles, which is extremely transmissible, is still circulating in the province, it will make its way into schools. I don't have to tell Alberta parents that virtually every school in the province is overcrowded. That's a perfect storm for measles to start to accelerate. So if you have kids at home who are under the age of 5 who may not be going to school but will get that secondhand exposure, you need to get them immunized now, because they're at highest risk and of serious outcomes, including things like hospitalization, ICUs, deafness, and other worse things, obviously. And as I said, in Edmonton, Calgary, you should be pushing hard to get the government to extend protection to 6-month to 11-month-olds. If you have kids who are going back to school, get them immunized. One, to protect the kids in your own family, but as Jeff mentioned earlier, not just to protect yourself, but getting immunized means you can protect other people as well. And a really important part of that in terms of schools is making sure that we have as many of those children immunized as possible so they don't come home and infect the ones who are going to have the worst outcomes. So those are the key things that parents need to do. And the one thing I want to emphasize is that if you do that, it will give you peace of mind, because your child will be protected and you don't have to worry about what anybody else has or hasn't done, because your child is protected.
All right. Gentlemen, we'll have to leave it there for time. Very much appreciate your time this evening. Thank you both.
Thanks
Thank
so
you.
much.